Mayo, whichever, Intelligender, oh, it's the same both sides. Hi guys, and welcome to my 14 week pregnancy update. I sort of combined the two because not much happened. I had to wait till I had my hospital appointment, which I had yesterday, and I'm almost 15 weeks now, so I'm just trying to quickly catch up and sort of generalize what's been going on. So I've got my notes again. Like I said, I'm just over 14 weeks now, so I may do like a 15-6 week. I might do them in 2 weekly blocks. I think I might do that. One, it's less effort, but two, there's not really much going on, especially with Christmas coming up, and I've got a few more videos that are going to be uploaded that are more Christmas related, and yeah, so I think I'll just try and, not much is going to be happening with baby and stuff over Christmas, so if there's anything major I'll update you on, but other than that, we'll just try and stick to 2 weekly or bi-weekly. So I had, like I said, I had my hospital appointment yesterday, which was basically just a sort of booking in to see the midwife and sort of start the process in the hospital. Last time with Hazel I had that appointment, and then I think a few weeks after that I went and did my glucose test and failed it, and then from that point I was at the hospital 2 to 3 times a week. In Australia, there's different types of care that you can have. One of them is like a midwife care, and a couple of the others, I don't know all of them, but one of the options that I was trying to do with Hazel last time was shared care, which is basically you do most of your appointments with your GP, and then for any major milestones or appointments, you go to see the obstetrician at the hospital, and obviously towards the end when you're due, you see the obstetrician at the hospital more often. Unfortunately with me, like I said, I went to the first appointment, which is just the booking in one, and then I failed the glucose test, which made me then high risk, and I ended up getting hypertension as well. So I didn't ever see my GP from then on. I got taken out of his care and straight into the hospital care, and I had to go 2 to 3 times a week to see various diabetes doctors and obstetricians and midwives and the whole lot. So this time I'm hoping I can still do shared care, and I went to the hospital yesterday for the booking in. On their paperwork, they have all the paperwork from when I was pregnant with Hazel, and already with my weight they weighed me, and I'm just over 15 kilos lighter. So at this point in my pregnancy with Hazel I was over 15 kilos more, or just over. So for me that's huge. I mean, it's not, I did lose a lot more. I've started putting some on. I've put some on before getting pregnant, and I've obviously gained a bit more now, but still to be over 15 kilos difference from this point in my pregnancy now and Hazel is huge, and hopefully that makes a bit of a difference with my results. So she went through just the general questions and worked out a due date of, I think, the 5th of June, which is what my GP was going with as well, and I think the ultrasound came back at like maybe the 7th or 8th of June possibly, so there's only a few days, so they're sticking with the 5th of June for now. At the moment, because like I said, that sugar glucose test that I had done prior to going to the hospital came back normal, I've still got to apparently see a diabetic doctor at some point, because I have had diabetes before and it's done. I've got obviously more risk of getting it, so I've got to see one. I don't know how often, they haven't really told me any of that yet, but they're just going to monitor it and see how I go. And obviously I've got that glucose test mid-Jan, so if I fail that, obviously I will probably be taken out of shared care and have to go into the doctors again. I'm sorry, breath, sorry. So I really suffer with breathing at the moment, and it's getting so hot. I'm not doing very well with heat. So yeah, I was 15 kilos lighter. They did my blood pressure, which they had notes from my GP that my blood pressure was higher, so she was going to monitor that and see how it's going, and she took my blood pressure and it was normal. I was so in shock. She was so impressed. So that came back normal, so I've got sugar levels normal, blood pressure normal. This is like a completely different pregnancy already. So at the moment they're pretty happy with me going with shared care, which means I don't have to keep seeing them. I can see my GP, and in case, obviously, if some of the tests start coming back wrong or negative, or problems like the glucose one that's coming up, then things may change. But as it stands, I'm not on any medication for my blood pressure. That's obviously, I had a high reading with the GP, but it's not continually high, so it's whether it was just that time of day or whatever. It's gone back down again, which is great. Yeah, she then did the heartbeat. She thought she'll just measure the heartbeat with the Doppler thing. And like I said, I haven't heard the heartbeat yet. I've seen it and I know it's there, but I haven't heard it yet. So she did the heartbeat and she was saying it was really quick. It was 166, which I think is the fastest. I don't think Hazel was that fast. But yeah, 166 beats per minute, which she wrote down. Again, like I said, the due date she had worked out was the 5th of June. So I have put on my, I think my pregnancy announcement video that it was June. I'm still predicting May. I know it's probably, I don't know. Hazel was born at 38 weeks and we were induced. My doctor said because you were induced at that time, you can sometimes naturally go at that time because your body expects to go at 38 weeks now. Whether or not that's true, I don't know. But you know, I'm sort of predicting getting gestational diabetes again, and I know that's sort of not very positive thinking. I just have in my head that I'll probably be induced again, so I'll probably be end of May, which is my birthday, so this should be interesting. But worst case, if everything goes smoothly, it's the 5th of June, so we'll see. I've sort of written off sort of end of May, June, it's sort of a variable date in the moment, so but on the bookwork at the moment we're 5th of June. So yeah, like I said, because everything's coming back normal at the moment, they've put me down for shared care. I do have to have, I've got a booking the end of January to see the obstetrician. You still have to see one appointment with the obstetrician at the hospital, and then I think pretty much until you're like 26 or 28 weeks, and then like 30 something, they're the only sort of ones you have to see the obstetrician at the hospital. Other than that, you do all your appointments with your GP. So I've got one appointment booked with the obstetrician, and it's actually the same obstetrician I had with Hazel. Because I was high risk, I saw him quite regularly, so we actually got to know him really well. So I was pretty excited that I could go back onto his team again. So I've got an appointment with him, I think it's like the 21st of January or something like that. So I've got that one. Other than that, I'm not even seeing my GP now until, unless my sugar levels are wrong at home, I'm not seeing him until whenever. I haven't booked him yet, so he's just said mid-January as well. I have booked my ultrasound, which I'm so excited about. I've booked it for, I think it's the 15th, Thursday the 15th of January, I think it is. So that is for my morphology scan. We are not doing the transnuchal one, which is the 13 weeks one. Obviously I'm now past that, so we're not doing that one. But I have the morphology scan, like I said, the 15th of Jan. So we will find out, as long as everything goes well and baby is cooperating, hopefully we'll find out the gender then. So I'm so excited. So that's the 15th of January. I will let you guys know as soon as I know, as well as close to as soon as I can. I don't really have any gender preferences. If it was a girl, yay, it's so much easier because we have all of, like, literally everything. We have everything that they could possibly need from Hazel. If it's a boy, we have everything. It would just be clothes, unless, like, a lot of Hazels aren't really neutral. They're all very girly, so that will be hard to find some neutral clothes that we already have. So the only real thing is clothes, but you know, we don't have a boy, so again, that's a positive. You've got a girl and a boy. So one of the other things I'm super excited about, this came in the mail, which are Intelligender. Oh, it's the same both sides. Anyway, I've got Intelligender, which I'm sure you guys have heard of. It's just for fun. I think they say they're about 70% right. A lot of people say they're horribly wrong, or they measure the pH in your urine, or I don't know. I've seen the YouTube videos and I've had a lot of fun with them. IVF Mama did them and I think they came out right for both. I think they said boy for Roman and girl for Mila Rose. So I'm not sure. I've seen them be wrong, I've seen them be right, but I just thought it'd be fun to do. And I will be doing that soon. As I'm 14. I think it says you have to be over 10 weeks. So I am obviously over 10 weeks. So I've got between now and the 15th of Jan to do some gender prediction stuff. So I will be uploading some videos, some fun ones. Obviously, they're all sort of old wives' tales. Apart from this one, this is just obviously for fun. But I will just do a few of those tests and just for fun and see what they come out with. So look out for those videos. They'll hopefully come up soon. I'll do this one probably, well, maybe not first. I don't know. We'll see. Keep watching. I'll see what I can get done. As far as that's pretty much, that's like my baby buys. I haven't bought anything. I don't think I'm gonna buy anything until we know the gender. Hopefully we find out on the 15th. There's just no point. I've got everything. If it's a girl, I will probably buy a few odd bits as you do. Yeah, I'm gonna hold off until I know what the baby is. We've got a few ideas on what prams we're looking at. We're looking at a double pram. Hazel's getting to the stage where she hates being in a pram, but I do find sometimes when you have the Tantra Toddler bleh. The toddler tantrums on the floor and stuff, sometimes it's nice, you know, to have them both in the pram so you know where she is, at least if you're in a busy shopping centre and that sort of stuff. So we're probably still going to get a double pram. It's just going to be too stressful. I'd rather them both in the pram. I know where they are. So we've got an idea of what sort of prams we're looking at. I've made hubby push a bunch of them, so he's happy with them. So I'll go more into prams in another video and what we've been discussing and pros and cons and stuff. So that will be coming up. And it's almost Christmas. I'm so excited. This is the most planned I've ever been. I have managed to get every single present wrapped and under the tree. Like, I am done. I've got 2 to post overseas, but apart from that, I'm done. I've already posted. We're doing a YouTube when we meet up, Secret Santa, which that is posted, and I've got a couple that I'm sending to my family in the UK, which I need to post those ones. But they're bought and they're wrapped. They're just ready. They're ready to go. But yeah, everything's under my tree. I'm so excited. I'm excited because Hazel's at the age where she's getting Christmas, you know, she's getting the Christmas tree, she's getting so excited about the lights and the presents. And yeah, I just think last year she was a bit too young. This year's going to be awesome. I've got Santa stuff. Santa's going to be visiting Hazel this year, so I will probably do a what is Santa bringing Hazel, like a stocking filler video. I might film that soon. It's already done. I've got everything ready to go. Like I said, I'm all prepped. That is probably it for my 13-14 week update. I will do a belly shot. I feel like my stomach is huge. I put a status on Facebook recently that I felt like I looked 6 months pregnant. I seriously do. I even said to the midwife, you can be honest, something's wrong, right? Because I should not be this big. I'm huge. Like, I don't even know. I'm almost 15 weeks and I look 6 months. I get you're meant to be bigger on your second pregnancy, but the baby's like, I think the size of a lemon, maybe. My stomach is the size of a friggin' soccer ball, like, seriously. Anyway, rant over. I'll do my belly shot and I will catch you guys for the next update soon. Thanks for watching. Please like and subscribe and I will see you guys next time. Bye. Okay, so here is my 14, almost 15 week belly from the front. And here is from the side. It is like huge, like, and I'm in maternity pants now. Like, we're getting into serious business right now. So here is from the front. Again, it's really swollen. It's hard. I didn't realize like how hard it would get so quickly, but it's gone hard even up here. I think my muscles are moving. So there is from the side and the front again. So that is it, guys. Thanks so much for watching. I'll catch you guys later.